Hello everyone, welcome to this panel discussion on virtual reality applications in medicine. I am Amitabh Chaudhary. I am a founder of Time Tooth Technologies, a company which builds robots and other technology devices. My colleagues here today is Dr. Subhashri Ramakrishnan. She is a professor at the Nimhans Hospital in Cognitive Neurology, and she is a specialist in brain-computer interfaces. And my other colleague here is Vaidyanathan Narayanan. He is the founder and director of Bionic Yantra Private Limited. It's a company which builds medical robots for the to work as a platform for rehabilitation of people with paralysis and other mobility disorders. So, Dr. Shubhasri and Vaidi, I am really curious to know about the way virtual reality and the other robotic technologies that you are familiar with have applications in medical devices. To begin with, I'd like to ask you, we talk about virtual reality and we have also other related terms like augmented reality, mixed reality, and so on. And of late, we are hearing a lot about the metaverse. So can you tell us what exactly are these terms? What is this virtual reality or augmented reality?
Yeah, maybe I'll take that question and Dr. Subhashri can add. See, basically, let's start off with the augmented reality. This technology basically allows you to embed virtual objects into the real physical world. And we also have this term called virtual reality. Basically, it involves the use of 3D computer models, and one of the most interesting types is the graphic design. So it helps you to immerse yourself in a fully 3D virtual environment. And then there is a much more newer evolving technology called mixed reality. This basically merges the real and the virtual world to produce newer environments and visualization. And essentially, the physical and the digital objects coexist and interact in real time. And then you have something called as extended reality, which encompasses the augmented reality, the virtual reality, and the mixed reality. While all these realities share some common overlapping features and requirements, each of them serve a different purposes and underlying technologies. And on top of this, we have something called as a metaverse, which is essentially a virtual space in which people interact with each other using various kinds of technologies. And the metaverse, which is being touted as the next generation of the internet, where you have a significantly higher enhanced user experience, while the VR is just a way to get it. And this evolving metaverse technology will be shaped by the technology by which we access it, which includes whether it be virtual reality, we can use augmented reality, and even brain-computer interfaces. So that's in essence is the overall technology stack, which is evolving very fast and rapidly. Dr. Subhashri, you want to add anything?
Yeah, so both AR and VR has revolutionized the therapy, the clinical practice, and the training of clinical and medical students. So there's a lot of scope in this area, and let's see one by one as we discuss. Let's look into those as well.
Thank you, Dr. Shubhasri and Vaidi, for explaining these new terms to us. So, how common is it that these technologies, metaverse or the augmented reality and the virtual reality, in India, how common are these in medical uses for rehabilitation or any other thing?
So, with regards to the medical scenario in India, virtual reality are being used with regards to patient awareness, with regards to the education, or with regards to the disease planning strategies, But as of now, rehabilitation and virtual reality, this is still in its infancy. It is making its baby steps towards rehabilitation. And it is not a common practice as on date. It is not a standalone therapy. It is generally combined as an add-on to the conventional treatment, and it is not commonly available. Most of it is in the research mode as on date.
I see. Okay. So can you give us some specific examples where they are used in the medical field?
So the applications of VR in healthcare is quite vast, and there are several sectors of medical field wherein it is used, ranging from physical rehabilitation, optical rehabilitation, aphasia management, cognitive rehabilitation, stress management, surgical training, planning, preventive medicine, telemedicine, senior care. So there's a whole lot of scope for virtual reality in medicine, and this will significantly impact the medical care as well, more in the domains of prevention, wellness, objective assessments, and functional training, interventions, procedures, or even to enhance patient adherence to treatment, and also in distributed care and telemedicine. So with regards to medical training, if we take, so not only in clinical skill training, it is also useful in the surgical skill training. It is useful in interpersonal skill training. So for example, if a senior doctor wants to teach the junior doctor, so there again, VR has its scope. Then there are several life-saving procedures and some things which can be simulated, say for example, emergency response. So those can be trained and rehearsed. Then even the doctors can develop empathy for patients by understanding the disease. Say, for example, a person with tremors in a Parkinson's disease. So he may be, the doctor may be able to feel the vibrations, feel the tremors, and that can help to boost empathy towards patients. And medical device training, say, for example, an orthopedic surgeon wants to learn about placing a tibial nail. So these virtual reality training, so the junior doctors and the medical community, they can feel themselves, they can immerse themselves in the surgical experience, and they can even observe surgeries, or they can even perform the surgeries from a first person perspective. So that is one of the important aspect of VR in learning, procedure learnings. So there are several life-saving procedures: endotracheal intubation, airway patency management, central venous catheterization. So there's a whole lot of life-saving procedures where VR can simulate in a three-dimensional way how the person can learn these procedures and rehearse these procedures before actually doing it in real. So surgical training, both for preoperative planning and also for image-guided surgeries, VR has a big role. I would like to just share one of the video here.
A doctor should be looking at a 2D image in 2016. They can grab a piece of tissue and take it out, evaluate it. EchoPixel is a software platform that we call True 3D for next generation displays. Our software drives these displays to create an open 3D space on the desk where doctors can load volumetric data like CT or MRI and see patient anatomy that they can reach in, create dissections, do general diagnosis and surgical planning in less time, better results. When a doctor gets in front of our system, they put on these glasses and they're going to see an object floating on top of their desk. And then they can move around the screen and they can see around the patient. And afterwards, they can grab a stylus and reach into that open 3D space, create a cross section or trace a vessel, or they can just simply grab a tumor and extract it as they might do during surgery.
So you can see that there is a three-dimensional visualization of the internal organs, and the doctor can very well plan the surgery and even rehearse the surgery. And with regards to procedural learning, so here again, say there can be a 3D simulation of surgical environment where the junior doctor or a group of team of surgical and medical doctors can learn the procedures here, as in this is a orthopedic procedure here. The doctors can even interact with the other team members. And advanced cardiac life support. So these are some of the things which are.
You're with a stable patient when he starts to have a cardiopulmonary emergency. Your co-team is off dealing with another emergency. It's clear there's little time to help this patient. It's been 10 months since your last ACLS certification. You're racking your brain trying to remember the right algorithms, but you can't. Sound familiar? It does to your clinical staff. ACLS competency decays within months after certification for those who work in non-critical care areas. With today's in-hospital cardiac arrest survival rates of 11 to 35%, it's clear that we're actively recreating the stress of a megacode.
Mr. Nelson is a 56-year-old man who's here for a PICC line.
The learner takes on the role of team lead, identifying different cardiac waveforms and using state-of-the-art voice recognition technology to direct virtual team members.
Andre, start chest compressions.
Starting compressions.
To shock, perform CPR. Phyllis, let's go ahead and shock the patient. Charging. All clear. And administer meds.
Aaron, administer 1 milligram of epinephrine.
Giving 1 milligram of epinephrine following AHA guidelines.
So you can see that these are several areas and scopes of medical applications of VR. And not only these, it is also useful for diagnostic assessments, medical image reviewing, neuropsychological assessments, physiotherapy, and then in approaches which is different from the standard environments, and also for digitized neurocognitive evaluation of attention deficit hyperactive disorders. It is also useful in several neurological disorders like stroke, traumatic brain injury, in speech therapy, optic rehabilitation. And one other important thing, acute and chronic pain mitigation. So basically it will distract the patient from perceiving the pain and reduces the need for anesthesia. So it is also useful in addiction management. And that apart, it is also useful in mild cognitive impairment, Alzheimer's, dementia, neurodegenerative disorders, and a whole lot, where several studies, meta-analysis, and review articles, if we see, they have shown a significant impact on the overall well-being and to treat these important mental and behavioral health problems. And also in psychiatric disorders. And there is also an important role in telemedicine, where a person can just have a smartphone over his Google Cardboard, and he can get his expert opinions from doctors from remote areas. There can be virtual humans for training and confidential interaction and telemedicine support, and virtual hospital tours to reduce the pre-procedural anxiety. And they can even form a digital health platform for enhanced analysis of data, and along with the entire combination therapy, so VR, AR with the digital health platform and the improved AI mechanism, they can help in health monitoring, voice monitoring, and patient monitoring. So these are a whole lot of bunch of scopes and the applications of VR in medical field.
Dr. Subhashri, that was quite a lot, a large diversity of applications that you showed us. I saw there were a few common elements, like, for example, kind of head-mounted glasses or head-mounted displays, and there were some big screens as well in some of the other images. And you also showed us these three-dimensional simulations of the operating theater. So I'd like to know, what are the different types of VR techniques that are available in the industry right now?
Yeah, I'll take that. Essentially, there are three types of VR. They fall into three different categories. One is it started off with the non-immersive VR systems. Then you also have what is called as the semi-immersive systems. And now what it has evolved to is a fully immersive systems. So essentially, when it started off, it was the non-immersive system involved using a desktop computer with a 3D graphical interface, and which allows the user to navigate with the virtual environment. And typically what is used is either the keyboard or the mouse is used, or even a joystick is used to interact with the images which come on the computer system. So these are non-immersive systems. Then you have something in between, which is semi-immersive, where there is a projection in the graphical display onto a large screen, and there are some motion recognition system or a gesture recognition system which kind of implement more natural interaction between the physical and the virtual environment. And now we have what is called as a fully immersive system, where there is a complete both the visual and the audio. It gives you a real life environment. Typically, what is used is a head-mounted system where so you are completely immersed in an environment, and it feels very natural. And I'd like to take through some of the systems which are available, which are being used in the medical context. So we'll start off with what is this is a haptic technology, where if you see the user is using a smart gloves, which gives him the sensation of sense of touch, essentially, and he can actually navigate this whole screen, which is displayed on the computer screen by touching the display. And here it is being used for upper body rehabilitation for stroke, where a person has acquired some disability due to stroke. Subhashri, you want to add anything here?
Yeah, so this is a subject with upper limb disability, and he's wearing those cyber gloves, and he's trying to manipulate and grasp those pegs. So when he, as he moves it, this is a fully immersed VR, where the person will be able to feel the sensations. He may be able to understand the proprioception, which means the relation of his hands with those objects. So all that he may be able to, it is a multi-sensory experience that the person would acquire using this immersive VR in this particular case of stroke rehabilitation.
Dr. Subhashri, you mentioned the word proprioception. Could you just explain what that actually means in this entire context?
Yeah, so proprioception or kinesthesia. So this is a term which is used for orienting oneself to the space outside and to understand the position or the location, the movement, the action, and with reference to the self. So that is one of the very important aspects of the tactile feedback which the person may experience in this virtual reality. So, yeah.
Thanks for that detailed explanation on the types of AR. I really missed out that point initially, that it is not just only the visual field, it's also the sense of touch and the sense of balance and so on. So all of that is kind of taken advantage of by the technology. So it's a nice insight into the technical aspects of the virtual reality. Dr. Subhashri, I was just thinking about your specialization in cognitive neurology, that is one domain of medicine, but there were also images related to cardiology and so on and so forth. So my next question is, what are the different specializations within the medical domain where these virtual reality technologies are being applied now?
So as we saw in the previous slides, it is not restricted to only the medical or the surgical fields. It has a vast application and scope ranging from the medical disorders like medical and the psychiatric disorders like the schizophrenia, the autism spectrum disorder, cerebral palsy, then Down syndrome. And it is also useful in VR therapy for dementia, mild cognitive impairment. Then it is also useful for speech therapy. It is useful in the ophthalmological therapy for amblyopia, that is for someone with a squint management. And then in gynecological procedures, studies have shown that it reduces the labor pain. Then it is useful in addiction medicine, where it can help them to de-addict. Then it is also useful in post-traumatic stress disorders. It is used to address phobias. So it has a vast role in almost any field. Say, for example, if one goes to a dentist, he can just show the virtual thing of how the dental carie will be removed. So a virtual educative or a patient educative resource material by VR can be easily available nowadays. And so these are the different domains in almost every subspecialty, and are using VR therapy.
And
Not
just to add, yeah, and just to add to Subhashri, it is also very, very relevant in our field of physical therapy and rehabilitation. For example, like in this the slide which is open, is essentially a semi-immersive system, but essentially used for gait rehabilitation, and also to learn balance control, and also to relearn functions, because some of them, they may have lost their function because of injury and all that. So you can actually use this system to relearn the function which they have lost, and things like that. So, and plus the cognitive element, right? Where even if there is a brain disorder, like Dr. Subhashri mentioned, you can again do some games and exercises which will reactivate this whole cognitive learning process. Yeah.
Very nice. So there are, there's so many different specializations in the medical domain. Vaidi, I know you are involved in a lot of research and new technology development and so on. And Dr. Subhashri, your work in NIMANS also has a lot of research component there. I was just wondering, for a common person not involved in R&D, just commercially, what kind of VR technologies are available? Can we just, for example, buy them?
Oh yeah. See, there are the most prevalent one now, which has become quite in the recent past, in the past 2-3 years, right? Are the head-mounted displays, which gives you the full immersive experience. And the leader in that space is Oculus, and because it was bought by Facebook and things like that. So there are different kinds of the VR modalities, and in the past few years, there has been the head-mounted technologies, which has become very prevalent and heavily used. The most common of them is the Oculus headset, which gives you a complete immersive experience. Of course, you have other like the HTC and the Samsung, and even HoloLens from Microsoft and Sony, etc. So these the technology has evolved so fast, and the cost of the devices have come down so dramatically, and the usage and the function have also gone up non-linearly. So the adoption of these headsets have become very prevalent in various domains, essentially in the entertainment and the gaming more so. And of course, like we heard from Dr. Subhashri, it is also very silently, perhaps, more research, but it has also made significant inroads into the medical, which will. There are also already commercially available VR. So that's where we stand. The good thing is that many of these technologies, because of their cost and the ability to build the applications, the virtual environments in the related domain, India also, we have access to these technologies quite easily in India.
Just to add, there is also haptic technology in VR. We have smart tactile gloves. So these are gesture and touch-based smart gloves, and some of these are wearable and self-powered. So these are also used in the rehabilitative domains, mainly for manipulation of the hand, for object grasping, for making gestures, and for the finger movements and the joint movements. So these are the other modalities of haptic technology integrated with virtual reality.
Thank you, Dr. Subhashri. That was very interesting. And I saw something very interesting there in that slide. There is one block which talks about Chinese sign language. Now, that would be something really, really exotic to see. So, so these technologies are not that uncommon. They are available, and some of them look those names sounded familiar. The Oculus and the other classes that you showed, maybe. Dr. Subhashri, can you maybe take us through some user experiences, case studies? How does it look in terms of when these are applied in the therapy or in the patients?
Yeah. So as I had mentioned earlier, these are not formed as a standard of care yet. It is only in the research mode as of now in the Indian scenario, but it is definitely proved in the West that it has become a very good complementary add-on therapy. And as a neurologist, I had spoken about the different domains of medical field where it is used. As a neurologist, I would like to show some case scenarios where it is useful. Say, for example, in Parkinson's disease. So these are subjects who have difficulty in walking, gait disturbances, tremors, and slowness. So there are several types of VR used for rehabilitation in them. The non-immersive one using motion capture cameras. Then there are immersive and semi-immersive ones where they are shown environmental or cognitive triggers which are known to cause gait impairment or falls in them. So the person rehabilitates in them. They learn to prevent fall. They learn to have a good gait and balance. And so these are some of the ones in Parkinson's disease. Then there are also, these are also combined with the controllers in the legs or pressure sensitive gait mats. So the main aim is to improve the gait symmetry and freezing of gait in these individuals. And I can just show one video.
And scientists also say virtual reality could help Parkinson's patients. Researchers at the University of Utah say patients who spent time moving through a virtual reality like this one, like a world like this, improved their balance. Plus, they were able to make their way around obstacles. The researchers say the patients were less likely to fall in real life after navigating. And scientists also say virtual reality.
And then in multiple sclerosis rehabilitation, so these set of patients have difficulty in walking, they have difficulty in speaking, they have difficulty in balance. So VR has shown to have a significant improvement in motor as well as the cognitive functions of these set of patients, like for example, improving memory, attention, gait, balance. Then there is a group of neuromuscular disorder. So this is where the subjects will have weakness of limbs. They may have difficulty in lifting or doing the daily activities using their legs or arms. So this is a scenario where a child with a specific type of muscular dystrophy, where he is performing using a touch screen interface. This is a virtual reality rehabilitation set up for a child with Duchenne muscular dystrophy. Then the other one which I wanted to mention is about the brain-computer interface based VR in spinal cord injury. So this is one example video. So spinal cord injury leaves the patient with difficulty in moving his head, legs and arms. And here, though the person is totally immobile, now here using EEG based brain-computer interface, now this person is able to control and move and guide the movement of this virtual avatar. So this is one of the areas of rehabilitative strategy for spinal cord injury in a research mode. This is a study from UC Irvine.
Yeah, Dr. Subhashri, so this patient has got a hand injury. Is it from the waist or is it from the neck downwards?
So patient is completely immobile from the neck downwards, and he's controlling the virtual avatar only by his brain signals. So he's able to modulate some of the signals from his brain, and he's able to control the virtual avatar, and that serves as a feedback to him. And this is one research modality strategy for rehabilitation.
So somehow the brain, whatever he's thinking is being captured as a visual image, is it? How does this?
It is probably the intent detection, right? The intention to walk forward or stop.
Yes,
That
yes.
is
So
that is
it
captured.
is a motor imagery based BCI. So it is like it's a binary classification where there will be a training session and then there will be a calibrating session, and the patient will be able to modulate some of his rhythms in the brain, and that will guide the movement. So basically, it is the thought per se which is able to modulate the brain signals and control the virtual space.
Yeah, this extremely new for us and very interesting. But just by thought, he is able to control the movement of the virtual avatar.
Yeah, that's very interesting. Yeah. This is another case scenario where virtual reality exercise therapy. This is in a subject with stroke. So he has gait dysfunction. He has difficulty in walking due to his limb weakness. Now using motion capture videos and cameras, so he's able to. So these are all exercise programs. So he's able to kick the ball by moving his leg, and that serves as a feedback to him. So in a very using a gaming strategy, person is able to move his leg, and that helps him in rehabilitation also. Then these are some strategies in mild cognitive impairment. So say, for example, rowing a boat or sorting a fruit or lifting the apple boxes. So these are some of the designs of virtual reality exercises. And this helps them to improve their attention, their memory, their visual spatial orientation. And not only these, VR is also combined with neuromodulatory therapy. So for example, this is a subject with stroke, and he's receiving transcranial direct cranial stimulation, and he's undergoing a VR therapy. Now this is a VR environment and functional near infrared spectroscopy system. So combination of hybrid systems can also be used in a VR environment. And then these are common.
The previous one, what is that FNIRS system?
So FNIR system, it basically detects the oxyhemoglobin and deoxyhemoglobin system. So based upon certain responses, or if supposing the person is thinking, or he's thinking of moving, or any activity that based upon the oxygen content, oxyhemoglobin and deoxyhemoglobin, there'll be a evoking of the cortical responses, and that can be, it is similar to EEG, and a non-invasive and a portable modality. And so it is something similar to a swim cap and electrodes on it, and this can be integrated with the virtual reality, and this can also be used for rehabilitative purposes. So these are integration of VR into the other domains. Similarly for the brain computer technology. So this is one of the GTEx application called RecoverX in stroke subjects. So here again, the EEG based, so the person is wearing a EEG based BCI, and this in combination with the virtual avatar. So he has upper limb weakness. So he moves his hand, and the virtual avatar also moves the hand. So he gets that feedback. And then there is a functional electrical muscle stimulation, so he gets a tactile feedback. So all these help him to improve the weakness of the hands and helps him to grasp with the hand. So these are some of the areas where VR is combined. So here it is a virtual avatar which is combined with the BCI technology. This again, this is from University of Houston, where the subject is wearing a EEG cap. And this is a EEG based BCI, where he is walking on the treadmill, and he sees himself on his legs are seen projected onto the computer screen, and the virtual avatar walks. So he sees himself, and this serves as this is something which we call as the mirror neuron. So when we see ourselves doing it, it also adds to the neuroplasticity of the brain. And this has also a role in the gait and posture rehabilitation.
Yeah, so can you just explain the terms, the neuroplasticity for the general audience here?
So when we say in neuroplasticity, it is the ability of the brain. So when supposing some parts of the brain, say for example, when there is reduced blood supply to some parts of the brain due to stroke, so that we call it a stroke. So when some parts of the brain is damaged, then the rest of the brain starts helping that affected part. So it is sort of plastic in terms that it is modulating itself to help the damaged part. So that is the speciality of the brain. And so neuroplasticity is one area which is exploited in this domain of virtual reality. One more last scenario where this is again a latest one. This is commercially available. The next med EEG based BCI. This is a gaming modality. So basically in this, the person is wearing a HTC Vive, the headset, and then he is wearing a NextMind BCI, which is a EEG based headset BCI. So both are coupled here, and he is able to control. So by modulating his attention, by modulating his visual attention, he's able to focus on the enemies appearing in the game. He's able to control. So he's not using his hands. There is no joystick. There is no keyboard. There is nothing that is interfacing between him and the computer screen. But it is only his brain and his signals that is controlling the virtual reality. So this is another frontiers in the rehabilitative aspect of VR and BCI. Yeah, so these are some of the scenarios which are having scope in VR rehabilitation.
Right, very interesting case studies. These are so as these technologies move from research to standard of care, there must be a lot of studies being done regarding their safety as well, right? Because there is signals to the brain and to the body and so on, tactile feedback. So so about the safety, what is the status right now? What is the current state of the technology?
So generally it is considered safe, but when we consider children, so all these head mounted display units, we can see in the warning box that they are not recommended in children below 12 years. So children, it's a different scenario. The brain is developing. It's an immature brain. It is developing. So for them to understand what is reality, what is virtual reality, and then to have a coordination strategy, and then to coordinate between the head and trunk. So all these are just developing. And so for them, it is not an ideal scenario for using VR in children. So generally, it is not used in children, but nevertheless, say children with cerebral palsy, children with Down syndrome. So when they have disability, VR does have it's a non-invasive thing, non-toxic. So it can still be combined with the conventional therapy and it can have its use. And with regards to elderly subjects, it definitely is useful. So for example, it will help them in reducing the pain. It will help them to tackle loneliness. It will help them in their disabilities for post-discharge follow-up. And so a whole lot of scenario, overall it increased their quality of life. So VR does have is safe in the senior citizens, and in children it has to be as of now it is not recommended. Vaidi, you can, if you want to add on anything.
Not really. I think you have covered most of it in your area. But yeah, I just wanted to ask you, rather more than add anything, in the physical and rehabilitation space, right? say you have, I think you mentioned that, but nevertheless, let me ask. When there is a very significant injury of the brain or even the spinal cord, right? Is there any restrictions there in terms of the disease type, or it's only the age which you mentioned is the restriction in terms of safety for the VR systems?
The safety in of VR in sorry, I didn't get it.
In depending on the levels of injury or the type of disease states, right? Some of them are very, very
yeah. So we cannot use them in severely ill subjects. So somebody with a cardiorespiratory disorder, or someone who is in an acute phase of illness. So they are not the ideal subjects. So in fact, in the West, there are some terms that is used. So a virtualist. So they use the term virtualist. So some of the clinics where they give VR solutions and VR apps and VR as a therapy. So there are a virtualist who decides on who should receive the virtual reality therapy and who should not. So it is not that everybody and anybody can get the therapy. It has to be customized, and it has to suit the individual's needs.
Yeah, just continuing a little bit on that topic of safety, Dr. Subhashri, you showed some gait disorders and how the VR was contributing to help them to rehabilitate from that kind of disabled or weakened state. Vaidi, I just remembered your work on the rehabilitation robotics. There is a part of it where you had talked about safety as well. Of course, I don't recall any VR component there, but you did talk about creating an environment where the people with paralysis could be given therapy. So is there, do you think, opportunities where your technology in robotics rehabilitation and the safety envelope that it creates can be combined with virtual reality technologies and kind of, enhance the treatment or the recovery of people with paralysis?
Yeah, absolutely. And just to give just to get a case study here about how our system works. In this case, yeah, go ahead. You have the mobile robot which is following the patient. So that is the one which kind of ensures that the patient is 100% safe in our robot. He also is wearing this technology. Mobile robot is integrated with an exoskeleton, which you saw he's wearing on his legs, and that helps in the actuation and rehabilitation of patients with the mobility issues. This is a case study in Niemann's. And if you notice that this patient, right, he had a remarkable recovery from in this case study for his gait and other rehabilitation. And one of the things which when I discussed with Dr. Subhashri and other things, right, if you could just go back a little bit, Subhashri, on the video. See, this is more on a controlled environment, right? Where the patient is 100% fall state, even without any other modalities like VR and all. There has been a significant improvement in the patient. In 30 days, he's able to do cross leg. He's a spinal injury patient who had a spine tumor in the spine, and he lost his ability to walk. And 30 days, he's able to walk. But in this, what the doctors mentioned is, there's definitely, to answer your question, Amitav, there is definitely a need for enhancing this and increasing his level of improvement. This is a controlled environment. Now you can use a VR system to help him navigate a home condition where the situation is not really controlled, right? And he still needs to navigate, and he can get further improvements on his newly acquired ability. So definitely there is a huge possibility. It's an ocean of possibilities actually to integrate the VR with our kinds of systems, so that you can not only enhance the user experience, but also make his learning and handle very difficult environmental conditions outside of the hospital situation to navigate. And we can really achieve that end goal for which has been talked for decades, but to get them completely functionally independent. That's the end goal of any of these rehabilitation. And we have already seen this patient at least come off our devices. So that itself is a good step, but he can improve further by help him navigate within his home conditions or even the external environment. At the moment, he's not able to. That's what I understand. Dr. Subhashri, you can add to this.
Yeah, so definitely with system like rears and wearable exoskeletons, robotic exoskeletons, VR itself is a special and a unique experience, and rears is a unique high-end robotic technology. So when there is a lot of scope for combination of these, and this will definitely help in subjects with stroke. So when someone has weakness of one side of hands and legs, or in subjects with spinal cord injury where they have weakness of the lower limbs and with or without the upper limb involvement. So yes, definitely this is one of a way ahead in the future.
Excellent. We'll all look forward to that, to see the robotics technology and the virtual reality technology being combined. And it's also very gratifying to know that the Triers robot is a completely indigenous product, right? It has been developed in India.
Yeah, that's right.
Excellent.
And, yeah, and just to add to what Subhashri and Amitav added, the fact is that we are at that cusp where even the technology is enabling these things to happen, and so that is actually the future for. So this will basically, and our technology, the one which the RARES technology, is a platform technology. So it anyway by default, by design, right, it allows for integration of various other treatment modalities, or like VR and other things. So we are in a good sweet spot, so to say, to exploit these upcoming technology. There's another one which is neuromodulation, which can be again integrated with RARES and change the paradigm of care itself for rehabilitation.
So when I was seeing the videos that the patients are being treated through these virtual reality systems, I was wondering how often do these treatments need to be given, and how many times? What is the frequency or the dosage of those therapeutic interventions? Is there some kind of benchmark or data on that?
So there is no hard and fast rule on that. So several studies and clinical trials have been conducted. So the frequency of the sessions, they may vary anywhere between once a week to 2 to 3 times a week for several weeks or months. So there is no uniform guidelines as such, and everything has to be customized, as I mentioned earlier, that it has to tailor to the needs of the given subject. It has to be tailored to the needs of the different disorder the person is suffering from. And so it can be from 15 to 30 minutes a session, or it can be 1 hour session. So there is no hard and fast rules with that, and it has to be customized. And yes, still it is in research mode. So that yeah.
Anything like side effects? Do the patients have side effects because of the VR?
So side effects, yes, there are some side effects. So for example, it's called as the cyber sickness. So it is something similar to the motion sickness or the sea sickness one suffers from. So when we say VR, it is a multisensory input and a modality. So the person experiences visual, auditory, touch, and then hearing. So it is a multisensory experience. And when the brain, which is the master of everything, it has to assimilate the information from different internal organs, like starting from touch, proprioception, vision, and then the inner semicircular canals, so the vestibular system. So everything has to be processed, information has to reach the master, the brain. And so some of the side effects like cyber sickness, and then nausea or dizziness, headache. So these are some of the side effects that are reported with cyber therapy and this VR therapy. And there are techniques also. People have come out with solutions for that as well. Say, for example, increasing the frame rate, or reducing the acceleration, or reducing the head lag. So on and so forth. So people are coming out with solutions for these cyber sickness as well.
I wasn't expecting that, but yeah, I mean, it just must be that even sensory overload can cause some kind of a side effect that needs to be planned for. Very interesting. So, well, all this raises two questions in my mind. One is that in general, most medical technologies that I'm familiar with seem to originate in the West and eventually make their way to our country. But some of the things that you showed us, both of you, Vaidya and Dr. Subhashri, they seem to be research that are happening within our country. So if you throw a little bit of light on the research directions, the research pipeline, and the new ideas that you or the other researchers in India are working on, that will be very nice to know. And the other question I had is that, again, because of the technologies coming from abroad, these are and when you see robots and stuff like that, they give an impression that these must be too expensive and maybe not for everybody. So the ones which are already there in the usage, or they are coming close to being becoming popular, how practical is it in terms of the commercial viability in the Indian context? So basically my questions are about the research being done in India and also the commercial viability of these technologies in the Indian context.
So I'll take the first question. So with regards to the research, yes, there are some ongoing research that is in the pipeline that say, for example, we have a collaborative project with IIT where we are planning to have a non-immersive virtual navigation space. So in subjects with neurological disorders, say stroke, dementia. So here basically they navigate and they do some of the activities of daily living, and that will help them in improving their gait and their motor and their cognitive ability. So these are some of the things in pipeline. It is basically a non-immersive modality that is in the pipeline. With immersive, we are yet to explore.
Yeah, I just want to add for the research part, right? Amitabh, the ongoing trials at with our robot, the bionic enter robot in Nimans, right? They have also changed some of the basic paradigm. Like, for example, the dosage for the patient, right, is given every day. A patient undergoes 1 hour of therapy, of walking therapy, and all the 5 or 6 days a week, which we have observed does not happen in many of the other technologies which are out there, and simply because of the way the usage and the way it has been designed in a way that it can be very easily accessible. And for example, even a simple on and off of the device, right, has dramatically reduced time. And because of the safety system, you can get the person to walk on day one without anybody holding on to him and things like that. So that itself has, even in the research domain, has changed the dynamics of rehabilitation. And we are seeing that really play out in the outcomes, the functional outcomes the patients have got. So yeah, so there is we made good progress, and I'm very happy to know, I'm very proud of the fact that this is a technology which all over the world they are eagerly awaiting this technology to be available in the US and the other markets, because of the simple fact of the very simple needs have been, even in the clinical settings, have been met, where there is 100% false safety. There is no special training requirements. A patient can, even though he's not walked for even say so 2-3 years, he can walk on day one and within 30 minutes, no anything special required. And the level of confidence which the person gets, right, is very, very high. So this is the first indigenous technology where it has been very path-breaking, and there is a lot of scope for, of course, improvement, and of course collecting data and going through the process of integrating it into the market and get it out there for patients to benefit.
Thank you, Vaidhi and Dr. Subhashri. This was very, very useful and very interesting. So after I go home from this discussion, I'll not think of virtual reality only as video games and apps and so on. There are so many interesting and really diverse fields where it is being applied. Thank you very much for sharing all this information with us. And if you have any comment to add or anything to anything further to add, please go ahead.
Yeah, I would like to conclude saying that VR, as of now, in the Indian scenario, it is only a complementary or a research modality. As on date, no doctors have come out saying that I prescribe you this much dosage, this much frequency of VR per week. That has not yet come as on date, but anytime in the future, yes, that may come. Along with conventional therapy, you can take up this VR dosage. So that can come up in the future. And we need to have adequate synchrony with the monitor devices. So in the clinical scenario, there are so many other equipments, monitors, diagnostic technologies. So all that has to go into a smooth digital health platform, and a proper synchrony with VR has to happen. And there is a huge need for clinical trials in our scenario, where the engineers and doctors have to come together, find out solutions, and tailor it to the patient's needs. And so that is one huge area, and there is a huge scope in this direction.
I just want to add, Amita brought up that the cost is maybe not per se for VR, but cost is an entry barrier for these kind of robotic technologies in India. But nevertheless, the VR, I'm pretty hopeful and confident because of the pace with the technology is evolving, and the clinical world, even in India, right, they are trying to adopt it very naturally into the Indian scenario. For example, right, I heard from Ajay that the CMC Vellore is trying to build a virtual operating theater for the entire human anatomy. So it's a very, very involved exercise, and it is good to know that there are takers for these kind of interventions. So there is a bright future for us.